Thank you for joining me today. My name is Dr. Houman Danesh. I'm the Director of Integrative Pain Management at Mount Sinai Hospital. And today we're going to be talking about pain management at home during the COVID-19 crisis. I treat all varieties of pain symptoms at Mount Sinai, from foot pain to back pain to neck, head, shoulders, basically anything that hurts, I treat it. So I have integrated both Eastern and Western medicine in my practice. And basically what I found is Western medicine, because of almost necessity, is a specialized upon a specialized, almost like a micro tunneling of information on one specific condition. For example, pain or headache or fractures. And so you have to become very specialized in order to treat those conditions. Eastern medicine provides a holistic approach in taking the patient's whole being into account, what they do for a living, what life stressors they have. What do they have for breakfast, nutrition, all of this comes together. And what I found is that you get the most benefit from combining both the Eastern and the Western medicine approaches. So headaches are the bane of many patients' existences, and those that suffer from migraines are truly suffering. And they unfortunately go undiagnosed for a very long time, and then until they find the right physician and they go on a treatment protocol. What's missed in all of this is that there are also other things that contribute both to headaches and to TMJ and to neck pain, because they're all interrelated. And I hate to say this, but your mom was right. So posture is extremely important. What I'm going to do is I'll demonstrate to you what I'm talking about. Is most people, when you look at them from the side, they're not aligned like this. They have a little curve to their shoulder where they're bending forward. Now, this small little curve, you may think, well, that doesn't matter. Well, the problem is when you curve your shoulder, you're also going to curve your neck down. So now your natural position is to look down, but who wants to look at the floor? So now all of a sudden you're looking up. And all of this changes the way force is transmitted through your entire body. So instead of it going straight from your head down to your toes, when you're curved like this, you're going to end up putting a lot of pressure both on your neck joints and your TMJ. What we don't realize is, since we live in such a life of luxury, there's certain muscles that we just don't use. And the main one here is the rotator cuff muscles. Those help stabilize your arm when you hold something up. We don't do this anymore. Even when you're on a subway, you barely hold up there. They now have poles where you hold right by your body level. So what happens is these muscles that keep your shoulder straight are also the ones that keep your shoulders apart. So we lose that ability, and then we compound it by going to the gym and doing 100 push-ups and tightening our chest muscles, which connect from here all the way out to your shoulder. And when those get tighter, you're also more in this rounded position. If you start looking at people when you're waiting for the subway, you'll see a lot of this position like this. And I guarantee you they will have at some point, if they don't already, shoulder pain, neck pain, headaches, and TMJ pain, and it's all related. It goes, the shoulder's weak, so these shoulders are rounded. This muscle right here, and people will say, I have a knot right here, starts doing the job of these other muscles, and it can't, so it tightens up, and you always have this horrible knot. This knot inserts here, but it originates right here in your neck. Touch these points here, and you're going to notice that they're also very tender. These are the joints deep inside, which can trigger a migraine, which will travel up to the back of your head and to the front of your eye. And because you're in this position, you can notice the TMJ is right here. Instead of being here, I'm in this position. It's an unnatural position, and this jaw is now opening and closing at a disadvantaged position and ends up wearing down and causing a lot of pain. The back pain is basically the same thing I just talked about up here, but lower down. So the main muscle there, though, isn't your shoulder muscles, because that wouldn't make sense. It's your glute muscles. They're the ones in your back that stabilize your pelvis when you do everything like walking, running, squatting, jumping. Those are key contributors to pain management as well. What happens is when those muscles aren't working, the pelvis starts to move and the joints below the muscles start to move. And those muscles are these joints back here. So if this is the spine that you always see, the blue stuff are the discs. And people will come and tell me, I have a herniated disc and I've had it for 25 years and I still have back pain. There is a likelihood, probably a very good chance, that your back pain is not coming from this herniated disc after that amount of time. What's probably going on is that all the changes that happen because of it. Your glute muscle sits right here. When this is not working, this is shaking. When this is shaking, these small little joints back here are moving and moving and moving. They're rubbing against each other. They become inflamed, irritated, and painful. Now, when all of a sudden you come to stand up after sitting for a long period of time, you're going to have a lot of back pain. You're going to say, when I stand up or get out of bed in the morning, I'm crooked. I have to take about 5 steps, and now I feel better. Now I can stand. I walk around. I feel great. Second I sit down for about 20 minutes, the same thing happens. I can't get up. This is all because your glutes are weak. What also happens is when you walk, you usually should be walking from your heel and pushing off on your toe. That position of pushing off on your toe is one of the most important movements while you're walking. The muscle that does that, you guessed it, it's your glute. So if that's not firing correctly, or if it's off, because when we sit all day at our jobs, we turn them off, and then they forget to turn back on. It's almost like it has amnesia. It's called glute amnesia, if you will. So what happens is you're not pushing off on your toe. Why does this matter? That means you're around the midfoot of your foot. And when you're walking, that entire force of your body hitting the ground, it's back and it stops at your knee. Usually when you go to push off on your toe, that force goes past your knee into your glutes and out of your body. So by forgetting or unlearning to push off on your toes, you're going to end up causing knee pain and back pain, which can then eventually lead to neck pain as well, especially if you have the condition of your shoulders, which can also lead to migraines and TMJ. It's all related. So there are a lot of things that COVID has brought that has made pain worse. Everyone talks about the core, and they just walk into the gym and was working their crunches, and they're thinking they're working their core. The core is more than 1, 2, or 3 muscles. You can argue it's more than 12. One of the main ones is the diaphragm. How does it relate to COVID? When you're stressed, thinking that the world is going to die, you're not going to have a job, you're not making any money, you forget to breathe. You end up taking a shallow breath. Why does this matter? Your diaphragm is part of your core. It helps you get a full breath. So when you're stressed and you're going and not going, that diaphragm is not doing its job. Your core is getting weaker, and that's going to start toppling the whole system down. So one of the main ways to not have back pain is preventative rather than once you get it. Once you get it, you probably need me. But to prevent it, your mattress needs to be less than 10 years old. What I find is patients will come to me and they've had back pain for about 10 years. And I ask them, how old is your mattress? I've heard as high as 40 years, which was sentimental, and I fully understand. I convinced her to get a new mattress and to come back and see me in 2 months, and she was completely fine. All of her pain was gone. So mattresses lifespan is about 10 years. So after 10 years, you're almost sleeping unsupported. So you're defeating the purpose of sleeping on that mattress, and force is just no longer distributed along your body. It can cause hip pain, back pain, neck pain, and headaches. Pillows are extremely important. If you're trying to get a good night's sleep and you're sleeping like this, if I told you, yeah, when I'm sleeping, I'm like this, you're like, well, your neck's gonna hurt over here. But when you have a flat pillow, you have the same exact condition going on. You're sleeping like this if it's too low. If it's too high, you're sleeping like this. And this is for side sleepers. For back sleepers, it's too low. You're gonna load these joints in your neck that I was talking about earlier. Too high, you're stretching those muscles and actually shorten these ones, which can also cause problems. Stomach sleepers, those are the worst sleepers. It leads to most issues. You should try to change your position to sleeping by putting a pillow between your knees and bending your knees slightly, so at least you can get from stomach slowly to your side. Other things, now that you're home and you're not doing your long commute, it's a great idea to get in a little bit of exercise every single day. Simple exercises like clamshells and glute bridges go a long way to building those muscles that A, we don't use, and B, because we sit so much, they turn off even more. So by exercising those early in the morning, you're going to make a big difference throughout the rest of the day. Other tips, do take deep breaths. Take a deep breath for a minute, at least once a day. Apple Watches do have that reminder on there. There are lots of reasons for them. This is one of them. So take a deep breath. Make sure you have the right posture support, and then the pillows, mattresses, and stuff with this posture support, and do exercises for your glutes mainly. And if you're not getting better, come in for an evaluation, because there might be other muscles that are tight and other muscles that are weak that needs to be addressed. For your upper body, which leads to migraines and headaches and neck pain and TMJ issues, there are lots of treatment things you can do for that as well. You can do just wall slides where you're going like this. You should watch a bunch of YouTube videos and get a lot of cues, because that one's done incorrectly almost all the time. But you want to strengthen your rotator cuff. You can do anything that requires you to hold your hands like this. Let me try to go, I should at least show you one side, and then you go up and down against the wall. That'll help strengthen your rotator cuff. Do not buy those devices that you put back there and keep buzzing you and telling you that your posture is not in the correct position. That's like trying to stretch a tight rubber band. You can stretch it for a little bit of period of time, but as soon as you forget, it's going to snap right back. So it's the same thing going on here. You have to build those muscles and the posture will come. For TMJ, you can massage your masseter muscle, which goes from your cheekbone down to your jawline. It's usually hyper-defined in patients that have TMJ, you might even notice, where you can see the muscle. And ideally, you can just either take your finger in and just massage it out. It might hurt a little bit, but that's a good sort of pain, and just rub it up and down. If you find a very painful spot, just keep your finger right there and keep pushing. You can also take a cork, take the cork, and you can push it in and start to relieve those muscles. The reason a cork isn't handy is because another way that you can open up your jaw a little bit is you can start by placing the cork in your mouth and eventually getting it so that you can put the whole cork in your mouth. So you try, you hold it here, you open a little bit, and then you get a little bit further. And that'll help get that full range of motion in your TMJ joint as well. Knees are also huge. I see a lot of marathon runners. One of the main things, most marathon runners already know this, is make sure you have the proper shoe wear. You don't have a wedge in the side of your shoe, because if you do, you're essentially walking like this. You don't want to walk like that. Or if the heel is completely worn out, you're not getting the proper support. The other thing is make sure you don't wear your wallet in your back pocket. Yes, it's related to your knees, because if I were sitting there like this, because I have a wallet on my right side, I'm both sitting funny and inactivating my glute and jamming something into that muscle, which is going to hurt it long term. So wear your wallet in your front pocket is also safer and wiser to do for other reasons. So going to your knees, most of the runners that I see, they have a tight IT band, and they tell me I'm stretching my IT band. No matter what I do, the IT band doesn't loosen up. Well, if you're getting your pelvic stability from your IT band, you can stretch it all you want. The second your pelvis starts to move, if that's the only muscle that your body's using to stabilize it, it's not going to work. So you have to strengthen, again, your glute, both the glute max and the glute med, and that will take you back to clamshells and glute bridges to strengthen those muscles up, which will loosen the IT, which will give your knee a little bit more range of motion, and then you'll prevent your injuries. Again, if you're doing these and you're not getting the results that you're looking for, you should come in for an evaluation, A, to make sure you're doing the exercises correctly, and B, to see if there are other muscles that need to be addressed. But these are very common. The glute muscles are very weak. You should be activating them. And eventually doing single leg squats. You shouldn't be staying on glute bridges and clamshells. Those are the introductory exercises. So running is an interesting one. I think, first of all, it's the mechanics of running. Not everyone runs the same way. And people will say, well, you have to have the right shoe for the way that you run. That's definitely important. And then the other component is, how do you run? You are not going to run the same on mile 1 as you are at mile 10, or if you're running a marathon, between miles 20 and 26.2. What's going on there is that you have found a way to adapt to your muscle imbalances so that you can run. But if you fix those muscle imbalances, the muscles that are tight, loosen them, the muscles that are weak, strengthen them, you'll have a more energy sparing run so that you won't break down as much. What I tell most people is you can usually get away with muscle imbalances when you run anywhere between 1 to 2 miles. Anything above 1 or 2 miles, you're going to start noticing my knee's really sore the next day, or the bottom of my foot's really hurting me after that run, or my back's killing me. What did I do? It's all because you have a muscle imbalance, and then you go and you're running. A lot of other patients feel that if they're walking or running, they're getting the proper exercise. It's great for your heart. I can't deny that. But if you're trying to prevent injury, running with the learned way that you've learned to walk, which is sparing those muscles that are already weak and relying on muscles that aren't designed to take that force, you're only feeding the problem. It's like driving on a flat tire. You can get away with it for so long, but eventually the rim's going to break down. So just pump air into that tire and you won't have any symptoms and you'll prevent injury. So TMJ symptoms vary. It can be mild and it can be all the way to a severe condition. You should always get an evaluation to see if you can get away with one of the approaches that I'm talking about of fixing the muscle imbalances, or I have teamed up with the ENT department at Mount Sinai for the cases that need surgery, that they're very quickly plugged into the surgical department. But you do need an evaluation, and there are symptoms that you should always watch out for. If you're having severe pain and you can't eat anything solid, you should definitely get evaluated. So things that you can do for TMJ, you can do a soft diet for 2 or 3 weeks, which doesn't sound like fun, but it does give you a chance to give your TMJ some rest. Also, stop chewing gum. Your TMJ joint, which is almost redundant because the J in TMJ, it stands for joint, but this joint is the most used joint in the human body. You can't stop talking, but you can stop chewing gum, which is the same idea. You can chew a mint. You can chew, or instead of chewing foods, you can have a soft liquid diet. You can massage this muscle here to try to relax this joint here. And if you're still having symptoms after that, you should come in for an evaluation. Nutrition is definitely something that's not talked about enough. And I think it's because there's so many different ideas about what could help nutrition. First thing first, if you're overweight, you're putting a lot of pressure on all of your joints. That's going to make the joints wear down faster. So that's a thing that you can do, is to lose weight. But then the question is, how do you lose weight? And if you're not overweight, what should you be eating to prevent injury or decrease inflammation? So there's a lot of ways of looking at this. First thing first, eat whole foods. So that's really, really important. Anything that's convenient that comes with a wrapper, it probably has some hidden items in there which worsen pain. Sugar is a big one, and it's hidden everywhere. Sugar, you need insulin to digest sugar. Insulin in of itself is an inflammatory mediator. What does that mean? You've heard, if you have pain, take 2 Advil, call me in the morning. So taking 2 Advil would be the equivalent of not eating anything that causes inflammation. So anything that requires insulin to be digested. Dairy is another big one that causes inflammation. Certain people have a sensitivity to things called nightshade vegetables, which basically is any vegetable with a seed. That can also cause you to go into an inflammatory state. There's dairy, we talked about, meat and protein. So unfortunately, a lot of chicken and beef also causes inflammation. So you're asking me, well, what should I be eating? You've almost listed everything that I enjoy. What can I possibly be eating? Look, this isn't about a diet. This is about a lifestyle. I'm not saying never eat these things, but if you are experiencing pain, eat more vegetables. More the better, unless you have a nightshade. But again, nightshades are only those with seeds. Eat more vegetables, drink more water, balance your meals, and each person should have an individualized, customized nutrition plan. And if you do need to, you can always speak with a nutritionist as well. But that's the overall idea. If you have no other choice to get a protein hit, and you do need protein, if you're exercising, keep in mind that your caloric needs are much higher than when you're not exercising. There are formulas, there are ways to figure this out. But based on your height and your weight and your muscle mass, you're going to burn a certain amount of calories by just walking, working, and breathing, even sitting. But if all of a sudden you are training and you don't replace what you're utilizing, so if you end up burning an extra 1,000 calories a day because you're running, that's a lot, by the way, but some people when they train for a marathon do, you are going to start breaking down muscle in order to meet that requirement, as well as fat, but you're also going to break down muscle. Runners notoriously will have stronger legs and upper bodies because as they're in that calorie deficit, they start breaking down the muscles in their upper body, which can then lead to them being crunched forward, having neck pain, headaches, migraines, and TMJ, because it's all interrelated. So making sure that your caloric intake meets your caloric expenditure is really important, and focusing more on fiber through vegetables and protein. So getting to your question about the packet of protein, it's convenient, it's easy. Just make sure there isn't a lot of hidden sugar in there, which will also increase your inflammatory state. Now, you do need sugar after a workout to help replenish. So I'm not saying no sugar, but the American diet is a little too high in sugar, more so than you realize. And so by not having it in that protein shake, if you have that option, is a good way of eliminating unnecessary sugar, as well as avoiding soft drinks. So if you're having a lot of pain and you can't make it because of COVID or because of your pain, you can always call the office for a telemedicine consult, at which point we would evaluate you by asking you questions and maybe making you do some cursory exam things. If it's a little bit more complicated, I will ask you to come in, because a big part of what I do is the physical exam to try to figure out what muscle imbalances you have, as well as coordinating with the physical therapist. There are physical therapists that will actually work on you. They'll release the muscles that are tight, the joints that are tight, and then show you exercises to keep you in proper alignment. You need to keep going to make sure that you're following that treatment protocol. I get asked this question all the time: how often should I work out? And quite frankly, the way I look at it is, you eat every day, you sleep every day, you need to work out every day. People are like, oh, well, I don't have X amount of time to work out. There are numerous articles that have shown that short bursts for certain type of exercises, if you do 5 minutes 4 times a day, it's equivalent of a 20-minute workout. It's about knowing who you are. And I don't mean that in this whole philosophical sense, although I do. I also mean it in, what is your limitation? If you're double jointed and hyper flexible, spending 5 days doing yoga, it's really not going to have the benefit for you if you're weak in certain muscles, particularly the neck, for example, or the shoulder and legs. Yoga will help with breathing exercises, which is part of your core. It'll help with strength, flexibility, but if you're already flexible, you may not be getting the benefits that you need. And it will also help you with the mind-body connection. However, there's the other component of it where you have people that are very strong and aren't flexible. So those types of people probably don't need to, quote unquote, lift weights. They need to focus on mobility. So that is something that is evaluated and told to the patient so they know what to focus on. So you say, listen, I have a deadline coming up. This is going to be a tough week. Well, if you're flexible, don't do yoga or stretching. Focus on some weight-bearing exercises, not necessarily weight lifting, because you can get a lot of the same benefits without even using a weight, which is even better on your tendons. So that's something that you talk about during the evaluation with me. But you want to, during that stressful week, you want to get in 5 minutes every single morning before you start your day, or in the evening when you're watching TV. And there are things that you can do even when you're watching TV, so there's no excuses. And most people are not commuting right now because of COVID. So there's also extra time there, but you have to fit it in. And so knowing who you are and where you fall on the spectrum, you know what to focus on. And when you have more time, you can go and do the things that you enjoy, be it weightlifting, yoga, or other types of exercise. Thank you for joining me today. I hope you found this useful. Feel free to reach out to the office at 212-241-6372 to set up an appointment, or you can always log on to mountsinai.org and make an appointment there as well.